Hello, hello, my friends. Welcome to another Sunday fun day on this beautiful sunny day. Luckily, it's not as cold today as it has been, so that's a plus. Your favorite RVT here, coming to bring you the tea on Veterinary. Today we are going to discuss chocolate toxicity and xylitol toxicity. Being that we are so close to Valentine's Day, we need to talk about this because, what do you do at Valentine's Day? You go and buy chocolates for your friends, your kids, your wives, your significant others, your life partner. You go and buy all these chocolates, right? And you do your best to try to keep them up and out of the way from your pet, but unfortunately, sometimes accidents happen, or we have dogs that like to scoop things off of the kitchen cabinets or off of the kitchen island or the kitchen table, or you leave it sitting on your nightstand, or you leave it sitting on your side table in your living room, what have you. So I don't know why my computer is laggy. I apologize if it's laggy and I'm all glitchy. It might take a minute to catch up. I don't know why. Sometimes Wi-Fi does weird things. And I guess maybe it depends on if I'm on my computer or on my phone. However, that being said, today we're going to talk about chocolate toxicity. So any questions, any comments, guys, please feel free to leave comments or questions if there's things that you would like us to talk about or like me to talk about. I'm absolutely here to do that. I'm here to educate you. I'm here to help you with any questions you need. Let me also preface this by saying I am an RVT, or a registered veterinary technician. CVT or LVT, you might also hear is called certified veterinary technician or licensed veterinary technician. Being that I am an RVT, I cannot treat, diagnose, nor prescribe for your pet, but I can give you some advice. So without further ado, let's talk about chocolate toxicity. With chocolate toxicity, the toxic component, the main toxic component in chocolate is something called theobromine or theobromide, potato. Sometimes caffeine can also be in your chocolates. There can also be caffeine in your chocolates, and those two can be toxic to your pets. Theobromine has some pretty serious side effects. The theobromine in chocolate can cause vomiting. It can cause diarrhea. It can cause anxiety or anxiousness. I guess not anxiety. We'll say anxiousness, restlessness, hyperactivity, similar to what caffeine will cause too. The theobromine can cause in our pets. Okay, so that's one of the reasons why it's so toxic and why we're, adamant on making sure that you keep these things out of the way of your pets. Theobromine, based on the chocolate that your pet gets into. So if you're talking about white chocolate, most white chocolates do not have any theobromine, or they have little to no theobromine in it. In the white chocolates, your milk chocolates don't have quite as much theobromine as, say, your dark chocolates or your super dark chocolates, your cocoa powders, your baker's chocolate, your semi-sweet chocolates. Those all have a lot more theobromine than your milk chocolates would have. So therefore, the dark chocolates, the baker's chocolate, the semi-sweet chocolate, your cocoa powders that you use to bake with, those will have more of a toxic effect than your white chocolates or your milk chocolates. Now, do keep in mind, there still are other issues with eating white chocolate or with eating milk chocolate as well. We will touch on those too. But in regards to theobromine, the majority of the theobromine toxicity comes from your dark chocolates, your darker chocolates. Okay, so do keep that in mind. And like I said, the theobromine, it does cause some pretty serious side effects. Of course, like I said, vomiting, diarrhea, restlessness, all the things kind of related to caffeine. It can cause. It can also cause other serious side effects like tachycardia or increased heart rate, which also your caffeine can cause increased heart rate. In severe cases, the theobromine toxicity or the chocolate toxicity can also cause muscle tremors. It can cause muscle tremors. It can cause seizures. It can cause seizures as well. So you really have to be careful about keeping your chocolates up and out of the way from your pets. Okay, keep them out of the way from your pets. Of course, it can progress. These symptoms can progress, and of course, based on how much theobromine your pet has ingested from the chocolate, it can be fatal if not treated. Okay, but that's in a serious case. Most people are pretty good about paying attention to their pets and keeping the chocolate out of the way, or when you notice that your pet has eaten chocolate, you can call poison control, call your local veterinarian. They can instruct you on what you need to do, whether you need to bring your pet in, if your pet will be okay based on how much we ate, what kind of chocolate we ate, all those things can play a factor. So, we're all pretty good about making sure we contact somebody, because chocolate toxicity is something that people not know about in depth, but they hear about or they're aware of something that's toxic in their pets. Chocolate toxicity is one of those that people are aware of. It can also cause cardiac arrhythmias. Just like I said, the theobromine is kind of similar to caffeine. So it can cause cardiac arrhythmias too. Do make sure that, again, keeping all this up and out of the way so that your pet can't get into it. They can't get into any of the chocolates. When you call your veterinarian, if your pet does get into any chocolate, when you call your veterinarian or you call poison control, do make sure that you keep that packaging readily available, or that you know what kind of chocolate your pet has gotten into. A lot of veterinarians, or probably most veterinarians, as well as your poison control, will have a calculator. So sometimes it's a little wheel that you spin around. Sometimes it's a calculator that they can pull up online, where you can actually see how toxic that amount of chocolate is to that pet based on their weight and based on how much they ingested. So that's why it's another good reason to make sure you call your veterinarian or you call poison control if your pet's got into any chocolate. So that way we know what kind of chocolate it was that they got into, whether it be milk chocolate, dark chocolate, white chocolate, semi-sweet chocolate, baker's chocolate, all of those things. Also, how much your pet could have gotten into makes a difference as well. The size of your pet makes a difference as well on the toxicity scale. When you think about it, smaller breed pets that ingest more dark chocolate are going to be more at risk than a larger breed pet that may have ingested the same amount of chocolate that the smaller breed pet has. Just based on weight and size, of course that does make a difference. So do make sure that you're letting the veterinarian or poison control know the size of your pet, which they'll ask anyway, the size of your pet, the amount of chocolate they ingested, and the kind of chocolate they ingested. Also, when it comes to Valentine's Day candies, you get the assorted box of chocolate, right? The assorted box of chocolate can have, filled chocolates. So macadamia nuts, things like that are also toxic to your dog. So you do want to make sure that you're letting poison control or your veterinarian know if the chocolate contained anything other than just chocolate, caramel filling or the fake strawberry filling or any type of nuts, peanut butter, things like that. You need to let your veterinarian know, because that too makes a difference as to the toxicity level in the chocolate, because other things can cause problems too in your chocolate, not only just the theobromine, but like the fillings or whatever having xylitol and things like that in them. So you do need to make sure that your veterinarian is aware of those things. With the white chocolates, even though they don't have as much or near if any theobromine in them, they will have a lot of sugar, a lot of sugar, and a lot of fat. So even though the theobromine in the chocolate, even though the theobromine in the chocolate can be toxic, the sugars and the fats can also cause problems in your pet. So you do need to keep that in mind too. And I'm sure you guys have heard of pancreatitis. Does happen in people as well. People also get pancreatitis. Basically, the definition of pancreatitis is inflammation in your pancreas. With the white chocolate, because it will have a lot of fat and a lot of sugar, it can cause a pancreatitis alone in your pet. So not necessarily worried about the theobromine toxicity or the caffeine toxicity. At that point, you're worried more about a pancreatitis. And again, it also comes into play, how much white chocolate did your pet get? How big is your pet? How much did they ingest? I can't preface that enough or stress that enough for you guys to make sure that you are letting poison control, your veterinarian, know all of those things. Try your best to gauge how much your pet ate, or whether it be dark, white, whatever. But pancreatitis can also cause serious issues in your pets related to white chocolate, even milk chocolate. Okay, so let's just keep all the chocolate out of the way if you can, and call poison control if your dog gets into it. In some cases, if it is mild, so if they had, let's say your 80-pound dog had 2 Hershey's Kisses, milk chocolate Hershey Kisses, is that going to be a huge problem? Probably not. Probably not, but it can be, because every dog is different, just like every person is different. So can it be a problem? Sure, it can be. It can be a problem, but will it be a problem? Maybe not. It may not be a problem. It may not be a problem. But they can have, some diarrhea. They can have some vomiting and some stomach upset. So not only with the theobromine, if it's not, a toxic dose, they will have some GI upset. Their tummies can hurt. They won't feel good. Especially with the white chocolate, vomiting, diarrhea. Of course, we can treat all those symptoms too. So that is something else, that if your dog does develop vomiting or diarrhea, even if it's a small amount of chocolate, your dog still needs to be seen by your veterinarian just to treat those things too. Because who wants to have an upset tummy? Who wants to have stomach cramps? I don't want to have stomach cramps. Do you want it? Nobody wants to have stomach cramps. You just really don't. It just makes for a terrible day. A terrible day when you have stomach cramps. Anyway, I digress. I had to make notes over here because, again, I digress and talk about other things that are completely unrelated. So we make notes. Because Selena's brain is everywhere else. So symptoms of chocolate toxicity with the theobromine. Okay, with the theobromine. It can occur within 30 minutes to a few hours of your pet ingesting that chocolate. So if you were gone for the day, you left your chocolates out, you thought they were up and out of the way, and your dog is a sneaky sneak and is able to get said chocolate from the kitchen or whatever. And symptoms can occur, of course, while you're gone. And as soon as you get home, do make sure if you notice these things in your pet, you call your veterinarian. So if you notice there's vomit and there's diarrhea on all over the house, and you see that your pet may have gotten into the box of chocolates and chewed up the cardboard, definitely give us a call right away and let us know. Of course, with the restlessness, and they'll be kind of hyped up, just like if you drink too much caffeine and you're all zingy. Your dogs can do that too on theobromine, so they'll just be really jittery and they can have muscle tremors, and it's a thing. So do make sure, you're calling your vet as soon as you see that your pet has gotten into something. But it can start anywhere from 30 minutes to 2 hours. They could start to see some side effects. What does your vet do? So what does your vet do? When you call us and let us know based on how much chocolate your pet got into, whether it be us or poison control, again, based on how much your dog had gotten into, they may advise you to bring your pet into the clinic. And when you bring your pet into the clinic, what we do, I'm going to tell you behind the scenes, what we do as RVTs, as vet assistants, veterinarians, what we do behind the scenes to begin treatment of your pet. So we do something called inducing vomiting. It sounds really terrible, and I imagine it is pretty terrible for your dog, but unfortunately is a necessary evil. I don't think it's painful. That's not what I'm saying as being terrible. I'm not saying it's painful, but who likes to vomit? I mean, is there really anybody out there that wants to vomit? I don't want to vomit. So we induce vomiting, and I'm sure they just don't want to vomit either. So we induce vomiting with the medication, and there are injectable forms of this medication that you can use to induce vomiting. You can actually use some of it in the conjunctiva in the eye. That's super weird because your mucous membranes absorb pretty quickly. So, you know, inside the mouth and inside the eye absorb pretty quickly, like with the flu virus, which is why, you know, if someone sneezes in your face, you can get the flu. Anyway, I digress. See, that's why I make notes. Induce vomiting. We'll induce vomiting in your pet. We can also see how much chocolate, well, kind of estimate, I guess, how much chocolate your pet ate based on, you know, their vomiting, which sometimes, you know, there will be food added into there, and if there's food into there, we're going to see food too. We'll induce vomiting once the stomach is completely empty, like that dog is bringing nothing else up anymore. We will wait until some of the nausea subsides, obviously. Maybe in this time frame, placing an IV catheter so that we can run your pet on some fluid therapy if needed. Again, that's also based on how much chocolate your pet ingested, how big your pet is, what kind of chocolate it is, okay? So after we induce the vomiting and your pet has vomited, we will also look through the vomit, see if there's any wrappers in there, if there's any nuts in there, if there's cardboard in there, or whatever else they may have chewed up, so we can find things. And it sounds really disgusting, but you know, in vet med, this is just a thing. So this is just what we do. This is what we do. This is what we're trained to do. We're trained to deal with disgusting things, and that just comes along with being a vet med. Okay, it just does. So you just take it straight. Place an IV catheter, possibly run your pet on fluids. Give them IV fluids, IV catheters, meaning intravenous catheters, catheters that go in the vein, not urinary catheters. I was told that before I came along, my husband, when I would just say catheter, he just assumed that you meant urinary catheter, because in human medicine, I guess they don't come in and say, I'm going to place an intravenous catheter, or I'm going to place a catheter. They say, I'm going to give you, you know, IV fluids. So you kind of know IV means in the vein or intravenous. So he wasn't sure. So that's what we do. We place an IV catheter, an intravenous catheter, to administer fluids to your pet. And once the nausea has subsided and we can see that the pet is no longer apt to vomit after we have given them the medication that makes them vomit, which it typically only lasts, I don't know, I think max is 30 minutes, how long that medication stays in the body to induce vomiting. I think 30 minutes is like max. I don't even think it lasts that long. What we will do is we'll give something called activated charcoal. And they actually do this in the human med too. You know, when people say they get their stomach pumped and then they fill it up with charcoal. So activated charcoal, not, you know, like you're thinking of we're going out there and we're grinding up charcoal from your grill and shoving it down your dog with water. We're not doing that. Okay. So it's something that is called activated charcoal. What activated charcoal does, it helps to bind and it helps inhibit absorption. So luckily, if we get that pet in soon enough, after we've eaten chocolate, we can get them in soon enough, we can give them that activated charcoal, which will help bind and inhibit absorption, I guess kind of coating the stomach and the GI, so that way the toxic effects aren't as severe. Okay, they're not as severe if we can get activated charcoal in there, get them to vomit, so that way their chances of recovering are better. They don't have as many side effects. So we'll give that activated charcoal. Now, a lot of dogs are not willing to take the activated charcoal, especially after you've been vomiting. So we do have to syringe it sometimes in the mouth, and it gets really messy, and we get it all over our hands, and we're all stained, you know, from activated charcoal for 2 or 3 days. That's okay. That's okay, because that's what we do, because we love what we do, and we love your pets like you love your pets. Okay, so we just do that. Administering activated charcoal and then running your pet on fluid therapy. So giving them IV fluids, because you know your liver and your kidneys are responsible for filtering out things in your body, right? So whatever you eat or drink is absorbed in your intestinal tract, into your body. So things have to go through your liver and things have to go through your kidneys, right, to be excreted from the body. So, you know, how you make urine, stuff is excreted from your kidneys, right? So we give IV fluids so that we can help with that excretion, speed up the process of excreting those toxic components, okay? And they do that in people too, by the way, you know, they do that in you too when they give you intravenous fluids. So that's what intravenous fluids are for. Help with urinary excretion, okay? We do need to make sure that we are monitoring that patient's cardiovascular system, because if they did get to a lot of theobromine and we have an increase in that heart rate, which is tachycardia, we do want to make sure that we can support that. So the intravenous fluids will also help with that. They'll also help with bringing down blood pressure if that blood pressure is up in that pet. So we do all these things with, you know, your pet when we're in hospital. Checking heart rate every 1 to 2 hours. We'll do that too. Well, you know, depending on the pet and the severity, it's usually a little more than that. If they're in the treatment area, we're walking by all the time, you know, dealing with other pets. There's always somebody in the treatment area that can monitor your pet. So don't think for any minute that your pet is ever left alone when your pet's in hospital. There's always somebody there. Vet med is crazy, and we're always busy, and we're always running all over the place. So there's always someone there, okay? This light is like really bright, and I'm having a hard time seeing. I might have to go close those blinds. Anyway, support the cardiovascular system. We may end up running some blood work, chemistry panels. We're going to check our liver function. We're going to check our kidney function, and we're going to check our electrolytes, make sure our electrolytes aren't off balance. All those things play a part in keeping your pet's body supported. Okay, we want to make sure we keep your pet's body supported, because if we're not giving supportive therapy, you know, what good are we doing to help your pet if they've ingested something toxic? You know, we got to do supportive therapy. We got to do that. Sometimes your pet can be hospitalized for 24 hours. Might only be 24 hours. And then again, it might be 48 hours. And then in severe cases, it'll be 72 hours. So do plan, if your pet does ingest quite a bit of chocolate, do plan to keep your pet in hospital for at least a day, could be more than a day. It just depends on how your pet is responding to the supportive therapy that we're giving, the fluid therapy that we're giving, just to make sure that your pet is going to be safe to go home with you. You know, that's what we do. We want to make sure that we can send these pets home with you safely, so that way you don't have anything to worry about. If we do have some gastric signs, so if we're having vomiting and diarrhea, even after a treatment or supportive therapy in clinic, or after getting fluids, we're having some vomiting and diarrhea, we will send medications home to help with that. Do send medications home just to help support the gut. Sometimes probiotics, send home with probiotics to help build up some of that good bacteria. You know, we'll do that too, just to support the GI, to make that pet feel better, because who wants to have an upset tummy for, you know, a week? We try to do what we can so that you don't have an upset tummy for a week, because no one wants to have that. Let's see. That also being said, they can be in hospital for 3 full days because of the half-life of theobromine, which means sometimes it can take longer to get out of the body and to be excreted. So it can take longer, so we will keep your pet in longer, and symptoms can last longer, so we'll keep fluid therapy longer and monitor your pet longer. Again, based on how much chocolate your pet may have gotten into, or what kind of chocolate they got into, the size of your pet, how much they ate, all those things play a part in that. No one has any questions for me? I feel like I'm just talking, and no one has any questions for me. I'm getting kind of lonely here, friends. I'm lonely. Who wants to come and talk to me about chocolate toxicity? Hold on just a second. I'm going to close this blind. I'll be right back. That blind is really bright. I think it's this one. Let me see. Is it that one? Oh, it is that one. All right, friends. Okay, Let's see if that helps. Maybe that makes me a little less bright. Okay, that's better. That's better. My goofy shirt I have on here. This is how I dress all the time. All the time. Okay. Chocolate toxicity. So yeah, theobromine is the main component. Similar to caffeine. Well, caffeine too can cause problems. So similar to caffeine, you know, can increase heart rate, cause vomiting, cause diarrhea, cause agitation or restlessness, because just like caffeine, you know, it'll make you feel amped. Of course, like I said, based on the chocolate, so your semi-sweet chocolates, your baker's chocolates, your cocoa powders, those are going to be the ones that have more theobromine in them. So if you are eating those, if you love dark chocolate, I am a dark chocolate fan. I love dark chocolate. I am not a fan of milk chocolate. I'm really not a fan of white chocolate. I really don't like white chocolate. My poor husband bought me white chocolate because he knows I like mint flavored chocolate, so like dark chocolate mint flavored. So for years, my poor husband, God bless him, was buying me peppermint white chocolate. And I just didn't have the heart to tell him for years that I hate white chocolate. Okay, so for years, this poor man continued to buy me white chocolate, peppermint white chocolate every year. Finally told him, I think this year or last year, I finally told him I hate white chocolate. So he has not got me white chocolate anymore because I hate white chocolate. So anyway, your semi-sweet chocolates, your baker chocolates, your cocoa powders, dark chocolates are more toxic than white chocolate or milk chocolate. Okay, but milk chocolate and white chocolate can cause issues with the sugars and the fats, pancreatitis, things like that. Okay, so it still can cause problems. So you still want to make sure that you're keeping that chocolate out of the way. And of course, chocolates can have toxic components if they have nuts in them. Okay, not all nuts are good. Not all nuts are good for your pet. You know, just don't give your dog any nuts at all. You know, don't give your dog chocolate syrup. Just don't do it. Just don't do it. Okay, just don't do it at all. Just don't do it. Since we're talking about chocolate toxicity, and then we talked about white chocolate and the sugar in white chocolate, the other thing I was going to touch on today is xylitol. So not many people know what xylitol is. Xylitol is a sweetener. Some people know what xylitol is. If you have a pet, you probably know what xylitol is, because I'm sure your veterinarian has told you before to, you know, make sure you stay away from xylitol. Make sure your pet stays away from xylitol. So xylitol is a sweetener that is used to sweeten sugar-free products. Sugar-free gum, sugar-free candy, sugar-free muffins, you know, sugar-free, sugar-free, sugar-free. So that's what xylitol is used for. It's not the only one. There is sucralose and things like that, aspartame, that are, you know, sugar-free sweeteners too, not just xylitol. But xylitol is the toxic one. Oh my gosh, I forgot to mention something. Let me go back. Chocolate toxicity. See, again, this is why I make notes, and I did, but I just skipped right over it. Cats don't tend to go for super sweet things. Cats really just don't care about chocolate. They just don't. I'm sure there are some cats out there that would eat chocolate, because not everybody's going to read the rule book. You know, I mean, come on, they're cats. Most cats won't eat chocolate though. But is it toxic to your cats? Yes, it can be toxic. Not toxic, but chocolate. Oh my Lord. Chocolate can be toxic to your cat as well. Okay, so again, keep all this stuff out of the way of your cat. Inducing vomiting in your cat is a whole nother ball of wax. It's not like dogs. It's totally different than dogs. Totally different than dogs. Typically, dogs are the ones that are going to eat the chocolate. Okay, so typically that's what we talk about, is the toxicity of chocolate in dogs, because most likely dogs are going to be the one to eat the chocolate, but cats can eat it too. Okay, cats can eat it too. We'll just say that cats can eat it too. So it can be toxic to your cat. Do call your vet. Do call poison control if your cat gets into chocolate too. Okay. Now we're going to go back to xylitol, since I forgot to talk about cats and chocolate toxicity. Now we're going to go to xylitol. Let's start over. Xylitol is a sweetener. The bird is applauding me for you know, jumping all over the place and making a mockery of this Facebook Live. Anyway, xylitol. Sweetener used in sugar-free items. So it can be in gum, which is where you most commonly hear xylitol being in, is in gum. Your veterinarians probably tell you to make sure that, you know, if your dog got into your gum, does it have xylitol in it? Does it have xylitol in it? They're going to need to know that. The xylitol is toxic in dogs. I'm struggling to talk today. I'm kind of hungry. Maybe that's why. I've only ate breakfast today, and it's 3:30. I probably should eat lunch. Gum, xylitol in gum. Xylitol can also be in sugar-free candies, can also be in peanut butter. So if you are giving your dog peanut butter, do check the label and make sure that there is no xylitol in your peanut butter, okay? Because that's toxic to your dog. No xylitol in your peanut butter. All natural peanut butter, if you can do it, all natural peanut butter for your pets. But try to make sure it's not super fatty. Because again, pancreatitis is a thing and can be a problem with excessive fats, okay? Peanut butter, baked goods. Xylitol can be in baked goods, sugar-free baked goods. Xylitol can be in there too. And you don't think about this, because you would think xylitol being the sweetener, it's just gonna be in sugar-free food, right? No, I'm here to tell you, friends, I'm here to tell you. Xylitol is not only in sugar-free foods, but xylitol can also be in your toothpaste. Yep, in your toothpaste. So xylitol can be in non-food items, like your toothpaste, your over-the-counter vitamins, your vitamins. You know, vitamins can be toxic to dogs too in large quantities. Some of those can be toxic to us in large quantities. You know, you don't want to take a whole bottle of vitamins. Just why would you do that anyway? But anyway, your dog might get into your vitamins. Xylitol could be in your vitamins. Mouthwash, Listerine, xylitol can be in those things too. I don't know which exact mouthwash has xylitol, but there can be xylitol in your mouthwash. Okay, can be in your mouthwash. Over-the-counter meds. So if you're getting a medication, if you're medicating your kid for a cold and you're giving them a liquid medication, you know, they're grape flavored or strawberry flavored or bubblegum flavored. I hate bubblegum flavored. That was my least favorite as a kid, was bubblegum. Grape, all the way, grape. Anyway, you don't think about that kind of stuff, but you know, if it's flavored, your dog might like the flavor of it too. And if it has xylitol in it, well, bad news bears. Bad news bears. I closed that line. I'm still, okay. Bad news bears. So no xylitol. Xylitol is toxic, okay? But it can be in non-food items, like your toothpaste and your mouthwash and your vitamins and your over-the-counter medications. So you do need to be careful with that, okay? What's weird about xylitol is it mostly affects canines, mostly affects dogs. Some mammals it doesn't bother at all. I don't really know why, and there's really not a lot of evidence as to why, and I'm sure we could go into why, but I'm not going to go into why today because I only have an hour to talk to you about this. And quite frankly, I really don't 100% know why it only affects dogs other than other mammals, which we could look into that, but I'm not going to. Anyway, so what xylitol does if your dog gets into xylitol, it can affect the insulin levels in your dog. Okay, so it can cause hypoglycemia. Hypo meaning low, glycemia or glyco meaning sugar. So low, emia meaning blood, low blood sugar, hypoglycemia, low blood sugar. So it can cause low blood sugar. And most people know what hypoglycemia is because you've heard it in diabetic people, you know. Get hypoglycemic. Puppies get hypoglycemic if they don't eat multiple times a day. Small breed dogs. We'll talk about that another time. Just so you know, your small breed puppies, if you have small breed puppies for Valentine's Day, make sure that they are eating at least every 3 hours a small meal to keep their sugar levels elevated, because hypoglycemia is a big thing in small breed puppies, and it can be a fatal thing if they get too hypoglycemic, okay? They gotta have that sugar. They gotta have a stable sugar, okay? So I digress again. Here we go. Causes hypoglycemia in your dogs. In some cases, it can cause hypokalemia, which is a low potassium, can cause low potassium. It also can cause vomiting. It also can cause lethargy or depression, or your dog just doesn't feel well. Can cause seizures. Xylitol can cause seizures in large quantities. It can cause seizures in low quantities when it does affect those potassium levels. I mean, your potassium is responsible for a lot of things. Your potassium is responsible for helping your heart beat normally too. So low potassium can cause all sorts of problems, so we don't want that either. What did I say? Hypoglycemia. Typically with xylitol toxicity, again, just like in chocolate toxicity, symptoms can start within 30 minutes, but it depends on what your pet ingested that has the xylitol in it. Okay, now think about it when you're chewing gum, with the gum, even when we swallow gum, it's not really digested all that well, because of what gum is made out of. So the xylitol in the gum is not as readily available immediately as it would be in like peanut butter or, some other food item, maybe candies, maybe your baked goods, your mouthwash, things like that. It's not as readily available because of the gum. So the gum kind of inhibits absorption of the xylitol, not inhibits it forever, but it takes longer, I guess I should say. It takes longer for the xylitol to absorb if they ingest it through gum. So it can take a little longer. That's not saying that you can wait to call your veterinarian. Okay, I'm not saying that, because you need to call your veterinarian as soon as you know, or poison control, as soon as you know that your pet has gotten into something with xylitol. Okay, so don't hesitate because, oh, it was gum, it will take longer. No, just go ahead and call. Just go ahead and call. Okay, you just need to go ahead and call. But it can delay symptoms because of the gum. Okay, anywhere from 30 minutes to 12 hours, your dog might not exhibit symptoms of xylitol toxicity for several hours based on what they've ingested that has xylitol in it. Okay, based on what they ingested that has xylitol in it. Let's see. Let me find let me switch to my notes so that I can try to stay on track, even though I don't. Still no comments. Still nobody wants to talk to me. I'm really sad, guys. I don't know why no one's talking to me, unless it's because my Facebook Live on my computer is so daggum slow that I'm not getting any comments and nothing is coming up. So that could be the case. So if you are saying anything, I may not see you because my computer is being really slow. So if you're not saying anything, I promise I will respond to your comments. I promise, I promise, I promise. I will respond to them. I promise. As soon as I see them. So I'm just commenting for myself right now with hearts. Okay. So in rare cases, it can cause xylitol toxicity, can cause issues with your pet's liver. Okay. So it can be a problem with your pet's liver. So do make sure that you are taking your pet to a veterinarian if you think they have gotten into some xylitol. Okay. What we will do, same thing we kind of did in a chocolate toxicity case, we will induce vomiting. We will induce vomiting in your pet. They do not recommend using activated charcoal just because the activated charcoal does not typically bind to the xylitol, so it doesn't really help bind it and get it out, which you still can do, I guess, activated charcoal just to inhibit absorption somewhat, so you can do that too. But I guess a lot of veterinarians might not do activated charcoal, and it probably just depends on your vet. Every vet practices different, just like in human medicine. Every human doctor practices different. Well, it's not different, for veterinarians. So the same way, to each his own. Some veterinarians practice this way, some veterinarians practice this way. They recommend this, they recommend that. It's always going to be different at which practice you go to. You know, across the board, they're, you know, pretty much the same on things, but for the most part, some of them practice a little differently. So do be aware of that they do practice a little bit differently. Because xylitol can cause hypoglycemia in your pet, they will want to run blood work, which blood work is always recommended anyway in any toxicity case, because you do want to look for baseline normal levels, and you do want to make sure that there aren't any elevations in any of the enzymes that we check for in those blood panels. Okay, so your pancreatic enzymes, your liver enzymes, your kidney enzymes, those are all checked when we do blood work on your pet. We also check their electrolytes when we're doing blood work on your pet. Of course, run CBCs or complete blood counts too when we're doing blood work on your pet. Not every pet has to have a CBC, but it is nice to have a baseline CBC. Anyway, and they'll also check glucose levels. So that's also ran in the chemistry panel that they run on your pet when, oh no, okay, I didn't stop. I thought it stopped. I got these notes that said we're running slow. This is killing me. Anyway, blood work. They're going to run blood work on your pet. Going to check glucose levels, monitor glucose levels. Because it can cause hypoglycemia, they're going to want to monitor your glucose levels of your pet. Probably start them on IV fluids as well. Support that system. Keep that blood pressure nice and normal. Keep them nice and hydrated. Also help with getting rid of those toxic components through the urine. So we want to keep them on IV fluids. If your pet is severely hypoglycemic, or if your dog's or your pet's glucose levels continue to drop, they are probably going to administer another medication along with the IV fluids called dextrose. Dextrose is basically like giving your pet sugar, okay? So we're going to administer some dextrose to bring those glucose levels up a little bit, because you need to have a normal glucose levels for your organs to function, for your body to function, for your cells to function, okay? So you have to have a normal glucose level. So they are going to probably give dextrose if your pet is hypoglycemic. If our blood sugar is low, they may administer an additional medication to help keep those glucose levels normal. Because if your glucose levels aren't normal, you feel terrible. I mean, you do. You can have seizures, you have headaches, you'll have nausea, lethargy. You'll just feel terrible. Okay, you'll just feel terrible if your glucose levels are low. So they will administer some dextrose. Treatment can typically can last up to, can last up to. Again, just like in chocolate toxicity, it can last up to 3 days. Okay, so do plan on keeping your pet in hospital. In severe cases, they may be there for 3 days. They may be monitoring your pet for 3 days. You might have to come back for some more blood work after that if they're worried about issues with your pet's liver. So you're just gonna have to be prepared. Okay, be prepared for whatever your veterinarian is recommending. Your veterinary professionals are recommending that you do if your dog has ingested xylitol in any way, shape, or form. Okay. They will keep your pet in hospital until those glucose levels, if we are hypoglycemic, until those glucose levels are normal. Again, because low glucose can cause all sorts of issues in your pet. So we do want to make sure that we're keeping those glucose levels normal. Okay, so again, your pet may be in hospital for a little longer than you anticipated, but just follow along with what your veterinarian says and do what they recommend. Okay. Yeah, so you wouldn't think about xylitol being in non-food items, you know, like medicine or vitamins. So do keep that in mind. If you do have vitamins sitting on your countertop, make sure they stay out of the way of your dog, because there are other things in vitamins that are toxic to your pet too, that can cause your pet to have problems too. So do make sure that you're keeping that stuff out of the way. Keeping your gum in your purse where your dog can't get to it, you know, making sure if your kid has gum that your dog can't get to it. Keep those Valentine chocolates off of the floor and off of any lower shelf, not shelves, I guess. Well, I guess it could be a shelf. Side tables, things like that your dog can get into. Okay, so let's just do a really good job of keeping that stuff out of the way, because chocolate is toxic to your pets. Xylitol is toxic to your pets and can cause severe issues. Trying to think of what else. And of course, you know, things can lead to pancreatitis too. So like I was saying, increased sugar in your white chocolate can lead to pancreatitis. You want to make sure that you're keeping all those things out of reach of your pet. And if not, call your veterinarian, call poison control, get your pet in and get them treated. Okay? Okay? Let's make sure we all do that. So I hope that some of this information you guys found helpful when it comes to chocolate toxicity, theobromine and caffeine, and when it comes to xylitol toxicity, places that you didn't think about that you would find xylitol, you know, in your non-food items. So I hope some of this has helped at least some of you. You know, if I can help a few people, that's better than no people. So I'd rather help some people. Sorry, I talked too much and I'm getting a dry throat. Yeah. So keep the chocolates out of the way, friends. Tell your husbands. Keep the chocolates out of the way. Tell your kids. Keep the chocolates put up. Better yet, just when you get the chocolate, just eat it. Eat it. I mean, who doesn't want to eat all their chocolate? I mean, I want to eat all the chocolate. Dark chocolate, which is the most toxic. Dark chocolate. Your extreme cocoa, like your 95% cacao or cocoa, however you say it, potato. Those are going to be your most toxic. Keep those up and out of the way. Okay, keep them up out of the way. Just eat them. Just eat them. Just eat them. You know, I like to, throw a little bit of business stuff in here on my Facebook Lives, because not only am I an RVT and love what I do and want to bring all this useful information, bring all the TEA or T, I'm not really sure which way it is, bring all the useful information to you guys and give you all the advice that I can give on any questions you may have. I also like to talk about the products I have in my boutique, because they're just super fun. Okay, they're just super fun. I'm gonna fail. I'll be right back again. I gotta do something with these blinds. I'll be right back again. There, we're just gonna close it all the way. I don't know why I didn't close it all the way the first time. It's because I like to do things the hard way. That's how I roll. That's my husband, he'll tell you. I do things the hard way. I'm a woman. I mean, it might be the hard way, but maybe it's a smarter way. Okay, maybe it's just a smarter way. Anyway, okay. So I'm gonna bring you guys fun things. I want you to look at the fun things that I have in my boutique. Okay, so those of you that have pets that eat really fast, especially in large breed dogs, you do need to be careful with bloat. They inhale a bunch of food and inhale a bunch of air, or drink a bunch of water real fast. You need to be careful with bloat because their stomachs can distend. Sometimes it can cause a torsion, or their stomach will flip, is what you'll hear. What we call that is gastric dilation volvulus, GDV, you know, fun terms. Anyway, you want to make sure, potato. Anyway, you want to make sure that your pet slows down when they eat. If you have those pets that want to just gobble, very food motivated dogs, they love breakfast, they love dinner time, they just love to eat. They want to eat so fast because it makes them so happy. I like to eat and it makes me happy. So I totally get those dogs that want to eat because it makes them happy. I mean, I enjoy eating. Who doesn't enjoy eating? Anyway, so if you have those dogs, I have something for you. Okay, so we have these slow bowls. These are slow feeder bowls. Okay, these are slow feeder bowls. So what they do is they pose a challenge for your pet, having to get the food out of the bowl. So it slows down their eating, so they won't eat so fast and they won't suck in all that air. They use these. So they have these little grooves in them. Here, I'm gonna spin this around so you can see the picture. There's all different ones. This one's a flower one. They have all these little grooves in there so that your pet has to go through all these little grooves to try to get their food out. So it slows them down, makes them eat slower. So that way They're not inhaling all of that food at one time. We're not worried about bloat or regurging. You know, they inhale all that food so fast. A few minutes later, it just all comes out in one big clump. Well, that happens. They can regurge if they eat too fast as well. I mean, if you eat too fast, you feel, you know, gross. So they're going to feel gross too. So slow feeder bowls. Slow feeder bowls. These are awesome. These are so awesome in slowing your pet down and giving them time to eat their food instead of inhaling it. I do have 2 sizes at my boutique. So this is a medium. This is a medium. I have a large for those big kids that need bigger bowls. Look at that size difference. So I do have a large in the slow feeder bowls. And this one's different. So you see how this one is the flower, right? This one is the flower bowl. Like I said, they have all different ones. So you can make it fun. You can buy a flower bowl, you can buy a circular bowl, you can buy ones that look like a maze and zigzags. I mean, they have all different ones. It's super fun. It's fun for you too. So see, this one is a spiral. So you can get the spiral one. It's a little harder for them to get out. And they do have these grippers on the bottom. This is like a rubbery plastic, so they can't push it around all over the floor, you know. So that way it's not scooting all over the floor. It stays where it's supposed to be. So I have 2 sizes. I have the medium and I have the large. I don't have any smaller than the mediums right now. All I have is medium and large. But I have these in my boutique. So if you're interested, send me a message on my business page where you're watching this right now. And I can work something out with you to get them to you. Hopefully before too long, I'll have a place where you guys can come and see me. I say too long. We'll see. We'll see. Anyway, slow feeder bowls. Love slow feeder bowls. That's one of my big sellers, along with the puzzles. The pet puzzles are the slow feeder bowls. Absolutely love the slow feeder bowls. I have these 2. These are super fun. So I have a toy chest for dogs and a toy chest for cats. So my toy chest for dogs is full of fun toys for the dogs. And I have people always asking, do we have any strong rope toys? Which it depends on your veterinarian. Some of them don't want you to have rope toys. You know why? Because they can swallow this rope, and this rope can bind and get stuck to something in their gut. And it actually acts like a, you know, kind of like a scissor, I guess, or a knife. And it can cut through your pet's intestines and cause problems as a foreign body. That being said, if your pet does not destroy the rope toys, they are super fun. This is one for super chewers, for dogs that will destroy things. These are really thick knots. I don't know if you can see that, but these knots are super thick, and they're not going to be able to tear these knots apart unless, you know, you got you a huge mastiff that's going to just work and work and work and work on this. You do have to be careful with rope toys, okay? So you need to be careful with any toy in your pet. So do be careful and pay attention. If they chew it up, throw it away. If they chew it up, just throw it away. Go get them something different. If they're heavy chewers, don't get them a rope toy. Get them a Kong. Get them something they can't destroy. But if you have a dog that just likes to play tug of war or just likes to chase a rope, like my grand dog, she doesn't tear things up. She didn't tear it up, but she likes to chase it, and she likes to play tug of war. So she's good with the ropes. She didn't chew them up. So we have these. I have these in my dog treasure chest, along with some other things. So look at those. Those should be cute. They come in a couple different colors. So there's that. And of course, I'm not going to leave the cats out, right? Because why would I do that? I love cats. Why would I leave the cats out? I'm not going to leave the cats out. I think last time with the cats, what did we talk about? Was it a laser pointer? I have laser pointers for cats too, which everybody knows about laser pointers and cats and how cats like to follow that with a red dot. So I have laser pointers too in my cat toy chest. But cats are predators, right? They like to hunt. They like to hunt. And what also do they like? They like catnip. They like to feel goofy. They like catnip. So, you know, I bought something that just combines both of those. What is that? That is a catnip tube with a feather. How fun is that? How fun is that for your cat? the feather, so it helps with that prey drive, that predator prey drive, so they can chase it around thinking that they're getting something, right? And then this is full of catnip. The tube is full of catnip. Who wouldn't want a catnip feather toy for their cat? I mean, I don't know. I have one of these for my cats. They play with this thing all the time. Like, they will go hunt this little dude down, and they will chew on it, and they will kick it, and they will roll on it. Cats love catnip, okay? It makes them happy. It makes them happy. Why wouldn't you want to make your cat happy? I mean, come on now. Look how cute that is. Different colors, different feather colors. You know, how fun is that? It's full of catnip, and it has a feather, okay? So these are also in my cat treasure chest. I guess I could tell you how much they are. These are $4.99, okay? $4.99 in my cat treasure chest. All my cat treasure chest items are $4.99. They are. All my dog treasure chest items, like this, these are $5.99, okay? All the treasure chest items are $5.99. My slow feeder bowls, the large bowls are $19.99, and the medium bowls are $14.99. So that way you guys know how much all that stuff costs. So anyway, yeah, you need to check out all my goodies. Check out all my goodies for your cats and for your dogs, all the toys. And I did post video. I posted 2 videos yesterday of my collars that I talked about on my last Facebook Live with Devin. My collars that I have, my super cute rhinestone blingy collars, and then my loofahs, the loofah dogs that you can squeak them, you know, loofah dogs are squeaky. I have rainbow ones, and I have Valentine's Day heart loofah dogs. Let me know if you want any of those. Again, drop me a comment, send me a message, whatever, and I will get those loofah dogs to you. They are also $5.99. Okay, loofah dogs, $5.99. And then the other video was for the Valentine's Day smoochers. So they are little gathered collars that you slip over your pet's head, and they have little hearts that dangle off of them for Valentine's Day. So you can dress your pet up for Valentine's Day. Who doesn't want a Valentine's Day dog or a Valentine's Day cat? Who doesn't want that? I want that. Who doesn't want to celebrate Valentine's Day? I mean, come on, they are the cutest thing. You can just dress your pet up. You don't even have to wear it for Valentine's Day. It has hearts on it. You can wear it anytime you want. Who said you just have to wear it on Valentine's Day? I didn't. I like to push the bar. I like to wear what I want when I want, no matter what time of year it is or what time of day it is or where I am. You know, I'm a rebel like that. I'm a rebel like that. You be a rebel like that too. Just put the Valentine thing on your dog and wear it anywhere, anytime, at any place. Why not? Who says you can't? You can do what you want. Who says you can't? You can do what you want. Anyway, guys, thanks for watching my video. I appreciate all of you liking and following my page. Please continue to share my videos. Please continue to like and follow my page. We are going to have something fun starting next month. Please make sure that you guys are tuning in with us on the second Sunday of every month starting in March. It is going to be so fun. We're going to have guests, and we're going to talk about all the things. It's going to be open table discussion. You have questions, you have thoughts, boy, lay it on me. Lay it on us. Let us know. We will be here for all the tea for you. So do make sure you tune in next month, which you need to tune into every one of my Facebook's live. Okay, let's just be honest, every single one. But we will be doing something different on the second Sunday of every month. So starting March 12th, we will have fun discussions with a guest. We're going to bring on a guest, so it shall be super fun. And who knows, we may have some drinks involved. I mean, who knows? Who knows? It's going to be super fun. It's super fun anyway. So guys, watch my Facebook Lives, okay? Watch them. Comment. Talk to me. Talk to me. Talk to me, guys. Talk to me. I want you to talk to me. All right. Well, thank you for tuning in. Thank you for listening to me ramble. I hope I brought you some useful information on chocolate toxicity and xylitol toxicity. So until next time, guys, have a beautiful Sunday. See you later, alligator.
Peace.